My name is Sam Harris. I'm a board certified behavior analyst, a BCBA. I'd like to give you a couple thoughts today on treating multiple diagnoses using ABA. Multiple diagnoses are pretty common. Oftentimes we'll see an individual who has an autism diagnosis, and besides that, maybe an ADHD or even ODD, or we'll see an individual who might have a diagnosis for bipolar, and in addition to that, there's PTSD and this and another thing. So when we see those multiple diagnoses for an individual, that's telling us this is a complex case. It's not open and shut. It's not really easy to understand. People are struggling to grasp what's going on with this person. And that's the same thing with changing diagnoses. Sometimes people will express frustration. Hey, last year they had this diagnosis, and now the doctor changed it and they added this and subtracted this, and they have some frustration there. What that's telling us is that the clinicians and the diagnosticians are having difficulty understanding this person. All right, this person that you and I care about, they're tricky to fully understand. Sometimes caregivers will be losing hope. You know what? They're changing the diagnoses all the time. Changing the medications all the time doesn't make any difference. Fortunately for us, serving a person effectively does not depend on having a clear diagnosis. The diagnosis is not the key. It doesn't solve anything. It is of limited value for changing the behavior. Now, getting a diagnosis is relevant to getting certain medical prescriptions, and it might change the medical path you walk. But in terms of the behavioral path, getting the right diagnosis, or diagnoses multiple, is not key. Doesn't fix the problem. It might provide some validation for families. Hey, we really are dealing with a very serious problem here. Look at the new diagnosis he has. Importantly, getting certain diagnosis might affect the funding and your ability to get ABA service. Autism diagnosis opens doors. It's just the way it is. Schizophrenia diagnosis opens certain other doors because it's perceived as a very serious diagnosis. So it can affect funding, but it doesn't affect our ability to serve an individual, because we as behavior analysts, we address behaviors, not diagnoses. The behavior that I'm addressing is defined the same way. I'm seeing such and such a behavior in such and such a form. It's taking this shape. It's happening with this frequency. The diagnosis the person has is not relevant to the definition of that behavior. So even when a client I'm serving obtains a new diagnosis partway through treatment, for example, this doesn't alter my perception of the person. I have worked hard to understand this individual for who they are. And the fact that they gain or lose one more diagnosis doesn't change who they are. They're the same person. They're the day before they saw that doctor, they are the same person as the day after they saw that doctor. So the doctor is helpful, and they serve in certain areas, but it doesn't change who the person is, the person we knew that they were before. So I do read the diagnoses. Whenever I can get any material from anybody, the psychiatrist, the psychologist, any therapist, anybody at all, I do read it, because I want to be aware of what somebody else saw. Am I missing something? Am I not seeing some aspect of this? Is there something I don't understand that somebody else saw that I need to be aware of and I need to follow up? So I do read them. I do pay attention to them. And I say these things because a behavior analyst who is looking at maybe serving a client does not need to feel intimidated when an individual has multiple diagnoses. Like, wow, this is just this is a lot. I haven't even seen some of these before. Okay, you need to be careful to practice within your area of professional competence, but the fact that they've got these multiple diagnoses does not change who they are as a person, and it doesn't change how we address behaviors. Because applied behavior analysis, ABA, is the study of human behavior. That's you and that's me. And that's our clients, regardless of what their condition is. And so if it's human behavior, we're all operating off of the same operating system. And if we have a firm understanding of that operating system, we will be in a place to help serve an individual. Now, don't hear me to say, oh, it doesn't matter the severity of the diagnosis, it's an easy fix. No, it's definitely not an easy fix. In fact, the more complex the case, the more challenging it's going to be. I'll talk more about that maybe in another video. But I just want to communicate that an individual who has multiple diagnoses, they can still be served. They can still be helped. ABA is still an effective intervention for those individuals that you and I care about and you and I want to serve. So thank you for your time. I hope that was helpful. God bless.